Good afternoon and welcome to Short-Term Training Allied Health here at Health Sciences at Ozarks Tech. I'm going to talk to you briefly today about our certified clinical medical assistant program, otherwise known as CCMA, and what you can expect going forward in this program. So classroom expectations, we are looking at active participation. We want you engaged in class. We want you on time. If you are late, the door will be shut and you will not be allowed in until the first break. We want you to be prepared. Read any online assignments and be prepared for any lab activities you may have in that classroom. And respect and professionalism. We want you to be respectful not only to your instructor, but your classmates and your clinical preceptors and clinical classmates. So when you're out in the clinical setting, we expect the utmost professionalism because that is a 160-hour job interview that you will be doing. Professional conduct in the clinical setting. We don't want to see that you're on your phone. We don't want you responding to emails from clinic. We want you to be engaged in the clinical setting, and if you're on your phone, you can't do that. If you use your phone as a medical device for something like diabetes, put it in your pocket and check it in the bathroom. Don't be pulling it out in front of other patients or other staff. Even though the staff may be allowed to be on their phone in the clinical setting, you are a student and you are not. We will write you up for this, and this can lead to a dismissal from the program if we find out. And we do have a lot of students in the workforce that tell us what goes on in the clinical setting, so rest assured we will know. Attendance and dependability. When you are set to go to clinical, be there and be there on time. Do not ask to leave early. Do not ask for medical favors. Do not act like this is your place of employment, such as medical favors. I would mean if you worked in a clinic and you were sick and the doctor said, here, let me listen to your lungs and give you an antibiotic for something. We don't do that because we're a student, right? We're in a 160-hour job interview. Teamwork. Never say it's not your job if it's in your scope of practice. You can always stock shelves, clean rooms, do whatever is asked of you. Patient safety. Patient safety is the utmost importance. Make sure you are keeping that in mind at all times when taking care of patients. Some professional expectations, ethical behavior, documentation of your clinical experiences. Do not clock in if you're not in the clinical setting. If you are in your car waiting for the clinic to open, you clock in when the clinic opens. We have GPS set up on our clocking system so we know where you are. If you are not clocking in at your assigned clinical location, we will know, and those hours will not count. Documentation of clinical hours. Make sure you're documenting everything correctly. Do not fudge or fake your documentation and say you've done more hours than you've done. We will know, we will find out, and we will dismiss you from the program. We use a program called Trajexis, and you're going to receive information from our clinical coordinator on how to set this up. Make sure you allow for GPS location device on this setting, and you use it through your cell phone. You clock in and out at every clinical site, clock in and out for lunch, clock in and out when you leave. Do not, if you forget to clock out, that's okay, we can fix it, but make a note on your phone, make a note in your car, clock out. Always remember to clock out, just like you would a job. You always show up in your scrubs. They need to be clean, odor-free, no rips, no tears. Do not go in smelling like smoke, vape, or other substance. You will be dismissed from clinical. Your ID badge should always be worn up here where we can see it, not at your waist. Accountability, make sure you are doing what you say you're doing. And communication, make sure you're communicating with your instructor, the program manager, your clinical team, everyone. The clinical coordinator, if she sends you a message through your email, respond it. You need to make a habit of checking your OTC email every day, at least once a day, if not twice. Check your spam because we will be sending you all kinds of emails, and our method of communication is through your OTC email address. Some vaccine requirements. COVID-19 is no longer required. However, if you've had any of the shots, boosters, any of them, it doesn't matter if it goes all the way back to 2021, we want those uploaded into my record tracker so they can have documentation of who's had it. That's only the thing they need it for. It is not for anything else. Flu, if it's flu season, you must have the current flu vaccine or an exemption on file. The exemption comes from the clinical site itself. We have no control over the exemption. Hepatitis B series is not required, but highly recommended. If you have it, we ask that you upload it. If you don't have it, we ask that you sign the declination stating you're not going to upload it. Same goes for COVID-19. If you've not had it, we want you to sign the vaccine waiver stating you don't have it and you're not going to get it. And the clinical coordinator can get those to you. Measles, mumps, and rubella are required 2 shots. If you are not immune, you will need a booster. If you cannot find your vaccine records from when you were a child, then you can go get a blood test drawn called a titer, and that'll show whether or not you're immune. If you're not immune, you will need a booster. Varicella, chickenpox, same thing. Just telling me that you had the vaccine as a child is not sufficient. You must either have a titer showing your immunity or the series of vaccines. Tdap, it must be tetanus, diphtheria, and pertussis. If it doesn't have pertussis in it, it is not valid. These are good for 10 years and must remain valid during your entire clinical portion. TB skin test is good for 1 year. You can do the skin test, a 1-step skin test, or you can do the quantum gold blood test. Either one is sufficient. If you are positive on your skin test, you will need a chest x-ray at your expense. My Record Tracker. This is the site we use to validate all your vaccinations. You are required to set up this account. You will receive an email from the clinical coordinator or from My Record Tracker directly stating how to get this set up. You will receive this information a few weeks prior to the start of your program from either MRT or the clinical coordinator. You need to upload all vaccines to this, everything. Information must be identifiable, have your name and date of birth. Upload your background check results to this site, upload your urine drug screen results to this site, and upload a copy of your valid photo ID, both front and back. My Certify, this is where you'll do your online background check. Certain situations can prevent you from enrolling in this program. So if you are on probation, a current active probation, you have pending charges that have not been heard before a judge, you are on parole, those are things that can keep you from being in this program. So if you have these things and you know they're going to come up, it's time to drop the program. You must start the background check immediately online because it can take a few days depending on how often you've moved. The drug screen process, you only have a few days to complete this. Once you sign up and pick a location for the lab, you must get it done. It is up to you to know the lab hours, the lab location, the lab requirements, whether or not you can bring a child with you to give a sample. If you miss your first appointment, we understand life happens and we will give you 1 additional appointment. If you miss the second appointment, you are being dismissed from the program because that is a requirement for all of our health science programs is to have a urine drug screen. And if after 2 attempts you cannot get this done, you are not in the program. Know when you're going. Like I said, know the rules, because if you go and they say, sorry, we took our last collection at 3:30 even though we close at 4, that counts as one of your attempts. Don't make that mistake. Marijuana and CBD that shows up positive on your urine drug screen, even though they are legal in the state of Missouri, they are not legal in our programs. They will have you dismissed from the program. You will see your background check at the same time I will, or probably even before I see it. And if you see that, know you're going to get a call or an email from me talking about a time we need to meet to discuss this, because you will not be allowed to continue in the program. Other must do. You must complete your Cox onboarding by week 2 of the program. You must go to the OTC bookstore and order your supplies and scrubs before the start of this program. You must go over to ICW and get a photo made for your ID badge. Drop dates, very, very, very important. This is a 16-week program. Drop dates are extremely important. You must have started My Record Tracker and Certify accounts and processes by the last day of the 100% drop rate for the Allied Health short-term programs. Failure to do this will result in program dismissal. If you've started by the 100% drop date but not completed, you must have all of this completed by the 50% drop date, or you will be dismissed from the program. If everything is not completed by the 4th week of class, you will be dismissed. That includes your Cox onboarding, your background check, and your drug screen and all vaccines uploaded to My Record Tracker. That includes everything. By week 4 of this class, you should be cleared to start clinical at week 8. Now, if you are at the end of the 50% drop rate and you're still struggling to get those vaccines and things uploaded, that's fine. If you reach out to me, the program director or the program manager, Becky Stevens, and let us know you plan to stay in this program, we will extend it. But know this, by week 4, if you have not completed everything, you will be dismissed and there's no refund. The 100% drop date and the 50% drop date give you some form of a refund back. Anything after that, there is no refund. Chain of the command. Your MA instructor is your first go-to. Then the MA program manager, which is Becky Stevens. Me, the program director, if you don't feel like you're getting anywhere, I'm in Lincoln 107 and my email is on the screen. And then you can go to the Dean of Health Sciences and voice your concern there as well. We ask you to go through the chain of command because if you skip over me and goes directly to the Dean, he's going to say, did you talk to Becky? Did you talk to Lee? And if he says no, he's going to send you back our way. So just do it the right way from the beginning. If you have any questions, you can email us at alliedhealthprograms@otc.edu. Otherwise, I expect to see you all thriving in class and everybody ready to go to clinical by midterm. Thanks. Have a great day.